What is GERD and how does it cause heartburn? Imagine that burning feeling in your chest after a big meal. That's often a sign of something happening inside your digestive system. Sometimes that uncomfortable sensation is just occasional, but if it keeps coming back, it might be something more. That something is called gastroesophageal reflux disease, or GERD for short. It's a common condition where stomach contents, including acid, flow back into the tube that connects your mouth to your stomach, known as the esophagus. This backward flow is called reflux. When reflux happens frequently, usually 2 or more times a week, or if it causes damage to the esophagus, doctors diagnose GERD. The main symptom most people notice is heartburn. It feels like a burning sensation behind the breastbone or in the chest area. This happens because the lining of the esophagus isn't built to handle the strong stomach acid. When acid touches this lining repeatedly, it causes irritation and that burning feeling. Some people also experience regurgitation, which is when you taste stomach acid or food in the back of your mouth. Other signs include nausea, chest pain, difficulty swallowing, a persistent cough, hoarseness, or a sore throat. GERD develops when a muscle at the bottom of the esophagus, called the lower esophageal sphincter, doesn't close properly. Normally, this muscle opens to let food into the stomach and then closes tightly to keep everything inside. But if the sphincter is weak or relaxes at the wrong times, acid can escape into the esophagus. Factors like being overweight, pregnancy, certain medications, smoking, eating large meals, or lying down right after eating can make this worse. If acid keeps touching the esophagus over time, it can cause inflammation called esophagitis or even lead to narrowing of the esophagus. In some cases, the lining can change, increasing the risk of esophageal cancer. That's why managing symptoms early is so important. Lifestyle changes like eating smaller meals, avoiding spicy, fatty, or acidic foods, and staying upright after eating can help. Not eating close to bedtime is also beneficial. Probiotics and prebiotics are often talked about for gut health. While they may not directly treat GERD, keeping your gut balanced can support overall digestion. Eating fiber-rich foods like vegetables, fruits, and whole grains can promote good gut bacteria and help with digestion, which might reduce reflux episodes. Over-the-counter medicines like antacids, H2 blockers, or proton pump inhibitors can lower stomach acid and ease symptoms. But long-term use should be checked with a healthcare provider. Natural remedies like ginger, chamomile, or aloe vera juice are sometimes used to soothe the digestive tract, but evidence of their effectiveness for GERD varies. Always talk to a healthcare professional before trying new supplements, especially if your symptoms are ongoing. If you experience frequent heartburn, trouble swallowing, unexplained weight loss, or signs of bleeding, seek medical advice promptly. These could be signs of more serious issues needing treatment. In short, GERD is caused by the backflow of stomach acid into the esophagus, leading to heartburn and other discomforts. Managing it involves understanding triggers, making smart food choices, and considering both lifestyle and medical options. Supporting your gut health with probiotics, prebiotics, and healthy foods can be part of your overall plan to feel better.